You know, I mean, I get it in the joints, but elsewhere also. So, because why all this?
The thing about the viral arthritis is they diagnosed it as sort of joint, but when we were working with it, it didn't really seem to be in the joints, it seemed more in the tissues, and all the tissues really throughout the body feel inflamed. They have that quality.
Okay, all right. Where is the most pain that you have?
At the moment, it's my neck and my lower back. But
Okay.
it was everywhere.
It was everywhere.
It was at a point you could press it, wasn't anywhere.
Okay, let's have you lay down, face up.
Do you mind me doing it? Sure? Just.
Ooh, cold. Very interesting. Feet are not cold, they're slightly cool. And touch here, cold, freezing. Freezing.
Hot hand.
Very hot. What's your blood pressure? And they're sweaty.
Usually about 146 over 70.
$70 in between systolic, $76 between the systolic and diastolic. This is a clear nervous system type. Must be impossible to have this weird. And you're 40?
30.
Sorry?
30.
30 exactly?
31 next month.
Oh, okay, I calculated the age right. I don't subtract that. So. No, I saw, what was it? Yeah, there was an age, but anyway. For her, 147 is definitely high. And 70 is totally acceptable. But, so it's interesting, so because her diastolic isn't high, they're not going to worry too much about it, and you didn't put any medications for it, right? Okay. So, if you were older, people would say, okay, fine. But it's your age, it's like, okay, what the hell is going on? Now, question for you, because, you know, you're not this, you know, you're not Miss Tweedy, right? So, was that your whole childhood, your whole life, or did it happen at a certain age?
Sorry, what?
Did you become more fatter at a
I've
certain
always
age?
been big.
Always been, okay. I'm just looking for, you know, different options of possibilities. Okay, so I'm just really curious about this reversal of, most people, when they're going to have temperature imbalances, they're going to cold feet and warm, the heat skips up. Okay, now, but and really hot here. Okay.
My feet are usually cold.
Yeah, it's very interesting. And the back is cold. Ooh. Don't help me. No, do not help me.
He's very fussy.
Well, yeah, there's something else going on, and I'm kind of curious about that, the head operation, if that created something. But hold on a second. Where is your pain in the lower back? Am I in the right spot, or do I need to go somewhere
It's
else?
sore, but it's usually a bit lower.
A bit lower, so more sacral, it looks like.
There.
Okay, so this is sore.
I usually put that down just to my nursing.
And the warm feet is due to? The warm feet and hands are due to? Not the nursing? Damn. Hi. How's the back?
Tender, but not too bad.
Okay, well. Don't learn from him. This is painful, right?
Yeah.
Okay. When I'm pressing on here, how is the back?
A bit better, but not.
A bit better. Okay, hold on. Now,
A bit better again.
how much is a bit?
Almost there. Almost nothing.
Oh, that's why I want percentages. She says a bit better, and I'm translating 10%. And now I'm at, well, what do you mean? Almost there. You know, excuse me, I'm from America. What the hell do I know? So percentage-wise, I would say you're saying 90% better?
Probably about 80.
Okay, so there's a little difference for me between 80 and a bit, but in England, maybe, no, every culture and every person is different. That's why, give me the damn percentages, and it annoys people as hell. because not everyone can do it, but you need to find a method of communicating that's going to do it. As much as possible. But so she's a nurse, so we say 1 to 10, because that's what they like. You know, they know the method. I'm going to take your hair away. Okay. You do not help. I can get there. 1, 2, 3, 4. Is this the area? Or
Yeah.
okay. How about the left side? 1, 2, 3, 4.
2 and 4.
2 and 4. And how about exactly on the center? 1, 2, 3, 4.
2, 3 and 4.
2, 3, and 4. Okay. Anywhere else there's pain, like more here?
I
also?
do get some
'Cause you said
along here.
Okay.
Towards my
1,
shoulders.
2, 3,
More 3.
3. Okay. 1, 2, 3,
2.
2. Okay. So these are the symptoms. Now I'm just checking abdomen. So when I poke here, you just feel my fingers sort of thing?
Yeah.
Okay. So think of nursing 70 years ago when people diagnosed this way. Okay, no machinery. Okay. Hi. Any pain? Discomfort? No. Feels the same as how about here? Yes.
Yeah.
Okay. So lung, digestion, immune. We don't know which one yet. How about here? No. How about here? Okay. Boom. Something. She's the first one that does not have her N9 pulse. Notice, it's interesting, so, you know, that most people do. Yes, something. Okay. No big deal. So definitely here, definitely here, correct? All right. No. 17, anything here?
Not really.
Okay. Sorry, I just want, the head is quite hot, okay, but then, you know, so it's really interesting. Extremities hot, and once you get into the center, it's cold. Okay, so any pain?
Not really.
Okay, this, okay, yes, okay. 1, 2, 3, 4. Any pain?
A little bit, but
Tell me which one. 1, 2, 3, 4.
2, 3 and 4. A little.
Okay, 2, 3, and 4. 1, 2, 2. Okay.
Yeah.
Stomachache. Okay. Or you can say gallbladder, you know, close enough to gallbladder 15 also, or Benshen is a. So Towei, the head. This is the head. The name head is in the name. Okay, very important. And Benshen, the root of the spirit, is gallbladder 15. So I'm very curious. Okay, so this one very obvious. How about 1, 2, 3, 4? 1, 2, 3, 4.
4 a little bit.
4 again. Towei or Benshen. Okay. 1, 2, 3, 2. Very clear. Okay, that's actually more stomachache, I would say, because it's more like in line with the edge of the eyebrow. Okay. All right. So 1, 2, 3,
Yeah.
and boom, right?
Yeah.
And boom, and 1, 2, 3. Correct?
Little bit, yeah.
Okay.
Did you start palpating there because of the scar?
Yes, no, but I have another idea. How come she's got reverse? She's like reverse of Jue. Jue is something wrong with the feet. See, I'm starting to develop this. I'm just being honest with you as to what's going on. So we start developing this idea of weird energy in the feet moving upwards, disturbing the chest and the head. But I'm starting to see people where it's the opposite. Something in the head is disturbing the extremities. You know, so if there's Jue, there must be an anti-Jue, quote unquote, you know, like physics sort of thing. So I've seen a few, and it's not clear to me, but also we have a pattern called stagnant blood in the head. She's a little bit of the reverse. Okay, the stagnant blood in the head is like postpartum depression. You created damage in the lower jaw. Like in pregnancy, you pushed or whatever, and the result is everything flushed up and you get postpartum depression. Okay, so hers is a little bit different, but her REN 4, my autoimmune guy, does a good job for L5, for the sacrum. Now let's see if he does a good job you had 1, 2, 3, 4, right? 2, 3, and 4?
Yeah.
Okay, so 2, 3, and 4. Ki, 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 ki. How's 2?
50% better.
50% better, okay. How's 3?
20% better.
Only 20. How's 4?
Almost there.
Okay, almost. Okay. Sorry, painful in the body?
Tender, yeah.
Ah, okay, okay. Sorry. How's 3?
Yeah, 94.
And this one? Okay, so I just had to move the point a little bit. So I know I know I'll do autoimmune for her. Okay, one of the problems with studying with me is like, I can just do the protocol, but I won't. So it's a little confusing. Okay, so yes, I will do autoimmune protocol. But so for autoimmune, for stagnant blood in the head though, is damages here goes to the head. I want to see if I can fix the head. Stagnant blood in the head is just like blood pressure treatment. Spleen 6, spleen 9, plus pericardium, plus lung 5. That's the only difference. Instead of under third toe, we do lung 5. That's called stagnant blood in the head. Like they show pain here or heat here or puff, or when you move, it's like, you see?
Specifically just
Mine
on the
doesn't
top.
move much. Okay, it used to not move at all. Okay. Some people, it's mushy, and you can move the it's like yours may be a little bit mushy.
Is it just on the...
Around 20.
Okay.
Okay, so she has a symptom in the head, and that's her very first symptom. It's something in the skull pressing. So I'm curious. I want to see, can I resolve this? So the worst one, if I remember correctly, was here. Okay. How's now?
85%.
85%, okay. Next, please. Hi,
Yeah.
95, okay. So, can I have someone help? Spleen 6, slightly up, this way. I would, okay, and then spleen 9 is up, totally up. Not too much force. Come from your body. Okay. How is 1, 2, 3, and 4?
3 and 4 still hurt.
I can reach with this split. Energetically, it's easier when it's the same person. I don't know why. Kiiko works with systems, doesn't seem to make a difference. How's Yeah, I can't tell you that I did anything different than she did, but it's energetically it's the same person. I don't understand. Okay, I'm going to start with spleen 6, 9, pericardium, lung 5. Let's see what happens, and move on. So notice I didn't even touch her. I don't necessarily have to. You can totally do whatever you want without doing the abdominal diagnosis.
Might be just worth mentioning, you've got that bruise, and it still looks quite
Oh,
bad
yeah.
from here.
Which bruise?
On the back of the calf.
Ooh, wait, y'all, what? Did his dog bump into you?
Self-inflicted.
Self-inflicted.
But do share
Mercy?
how long ago it was and how you did it.
Last Saturday in France, went to the rugby and they got fixed seat. And I jumped up a few too many times and there's a bit of acne.
So it's just jumping up and down on the seat.
Yeah, you can see.
And this is like a week ago.
The story is interesting. You went to France, did you say?
Yeah, see the rugby.
To see the rugby. It's his dog. And they did the rugby in France?
She was watching and she was celebrating by jumping up and down in the seat. And so this bruise is just caused from sitting, like jumping up and down. But that was a week ago and it's this bad.
Yeah. Well, some people bruise in ways that, you don't know what kind of jumping she did. Look, let's put it this way. When I play sports, I want you on my team. Don't want you on anybody else's team. So so spleen 9, notice that it's just totally upwards.
Always?
Yes, I don't have a spleen 9 that goes towards gallbladder 34. Because the channel doesn't go towards gallbladder 34.
Upwards, again, upwards to
Come
the...
see. Come see.
Okay.
Is there any pain there? Okay. So, anything, remember, now between 4 and 6, which one's going to do a better job on the neck? 1, 2, 3. Okay. How about now? Okay. Not really, no pain.
About 95%.
Okay, yeah. Now, I made a huge mistake though.
Thank
If I want to do autoimmune, I have to check, at least I have to know which kidney point I want to use. Now, if she happens to have pain on kidney 2, how about here?
Small bit.
Okay, this one's okay. This one I have to decide now. While there's still pain somewhere, I need to get decide which kidney point I use. But I could conceivably do it from thyroid. Anything here? Okay. So, attempt number 1. Hi. How's that?
80%
80%
better.
better. Compare for me, I don't think it'll be 9. Because I could feel a tautness in kidney 7. Hi. How's this?
No change.
No change. Okay. So, I just need to make sure I have choices of points. Because lung 5 I'll have. Remember, Ren 4, lung plus kidney. My lung is set for me through stagnant blood on the head, but my kidney isn't. So
The stagnant blood in the head protocol is the spleen point.
spleen 6, spleen 9, lung 5, and pericardium. So we decided on pericardium 4 because it did a good job for the neck, but then I went, wait a second, if I have nothing left to check, how am I going to get my kidney points done? Because Ren 4 I already did, and I already know that it's slightly below where I think it is. So that's the other thing, is once you start working with your hands, you kind of, you remember, I know that it's not Ren 4, it's ever so slightly below.
Could you explain why the points are used for the stagnant blood in the head?
Honestly, I don't know. It's one of these combinations. There is an expression that says this emotion of spleen is too much pressure. We say overthinking, but there is another way to look, when you look at the character that was used in one of the descriptions, the character basically too much pressure. That's why we think spleen has to do with blood pressure, because that's the same as blood pressure to me. Blood pressure, like overthinking, you're pressuring me, is spleen. So now we found that these are the best points. Any discomfort here? No. So 1, 2, 3, 4. 3?
3 and 4.
3 and 4. Okay. Hi. 3?
90% better. 90% better.
90% better. And 4?
Mostly there, yeah.
Mostly there. Okay. So we'll take pericardium 4. You okay?
Yep.
You didn't like the needle? What? Tell me.
Normally I giggle when it starts to hurt.
When the needle hurt or your pain starts
Needles.
to hurt? Okay. You go to nursing school, you kind of have to cope with the needles. So you giggle. All right. So let's check the head now. And the pain, of course. So, worst one?
Much better.
Okay. You had here too.
Yes, fine.
Fine. And 1, 2, 3.
3 still.
3 still. Okay, fair enough. And you had here?
Much better.
Much better. Okay, and you had 1, 2, 3.
2 and 3.
2 and 3 you can still feel. Okay, in the neck. 1, 2, 3, 4. No. Other side. 1, 2, 3, 4.
4 a very small bit.
I know you want me to take a bigger needle. You don't have to. But you will get it to the handle because there is a certain, I mean, there's a certain point here because I actually am almost trying to touch the mesentery. Yeah, got it. Okay. And then kidney 7 and 10 on this side. So basically what I did on her is dogma. Autoimmune plus stagnant blood in the head, and I worked totally off medical history. I checked it because I basically ignore her often. So it's totally possible to do it. To ignore, I'm not saying it's a great way to do it, I'm just saying you'll have options. However, to do this option, you have to be really versatile in like all the protocols. It's like you in your computer, you're just mixing it all up and going, okay, this one, and then still test it against, you've got to test against something. I don't care if you test against the knee, against the head, against the ear, against whatever you're testing, but test it. So you don't have to use the abdomen. How are you feeling? Not too bad. Okay.
Why is it that they come in sort of pairs? Is there a reason?
Pairs?
Well, yeah, because they normally come in point pairs, don't they? Is that a correct sort of assumption?
Explain. Tell me exactly what you mean. Like a protocol has more than one point.
Yeah.
This is not pair. This is a quadratus, whatever it is, quartet.
Sure.
So because one point sometimes is the main one and the other one is supporting it.
Yeah.
So it's a little bit like what I say, take insurance.
Okay.
It's like, yeah, maybe, so like, for example, with adrenal, the lower kidney point, now going to use to say, strengthens the adrenal, and the upper one, reduces the parathyroid. When the adrenals are down, like look at women in menopause, the adrenals are down, the gonads are down, okay? And then the parathyroid gets active, leaches out the calcium out of the bone.
Mm-hmm.
Okay, so he's subduing the parathyroid, kidney 27 subdues the parathyroid, the kidney below strengthens the adrenals or the gonads.
Mm-hmm.
Okay, so it's, sometimes it's a question of balance, like sometimes it's a question of strengthening it, so I think it makes sense, and because like if you looked at herbal formulas, because you guys are not herbally oriented, it's a very standard concept. No Chinese person gives one single herb. That's a Western herbology methodology.
Yeah.
Okay? In China, it's always, so yes, you have formulas with 2 or 3 herbs. Well, 3 is generally, if you have one major formula that we think of as 2 herbs and everybody modifies it and adds. We don't trust, one herb.
Yeah.
3, like, so when you're looking at very small formulas, it's 3 or 4 herbs. Very elegant, beautiful, ancient formulas, 3 or 4. So the same with acupuncture. You wanna like. By the way, talking about that, inner yin for someone her size or bigger. Okay, when you do a point on the lower leg, sometimes it doesn't transmit so well because there's the extra tissue that it has to go through. Then we add in here to sort of shuttle the point upwards to move it further. So it's another pairing. We also always think in terms of spleen, for example. Spleen and liver work beautifully with pericardium. Kidney works beautifully with lung. Okay, so if I did spleen or liver, I'm going to look at, can I add pericardium? If I did something kidney, I'm going to think, should I add lung? Okay, so, but yeah, a lot of the combinations just not, especially for the more constitutional type situations, are combinations. It's true. Yeah. But you have a few that are, like liver deficiency, liver 1.
Yeah.
Liver excess is a quartet.
Mm. Okay.
Shaoyang, remember, at least the SCM, officially, I'm saying you can just use Sanjiao 8 or Sanjiao 5, but supporting point is called about a 40 or 41 for 5. So yeah, there's always the idea, can I do more?
Mm.
Make sense?
Yeah.
Let's let Alec out. Okay.
Sorry, how do you follow 3 fingers?
It's 3 fingers. Oh, what you do is you palpate very lightly and you'll find a hollow. You see, on me you can see, but on most people you can't see. So you go very. So the arm is well, put your arm on his butt. So you go very lightly, and here, right here, you'll feel that there's a little, like something.
Yeah, about there. Okay.
So it's about 3 fingers.
Yeah. And your lung, you're just dropping into the.
Sorry?
And the lung 5, you were just going this side and that way.
No, you're too medial. You're too medial for lung 5. My lung 5 is here.
All right, over there. Okay.
All right.
Yeah.
Let's have you. Oh, sorry. Can't have you do anything. But you could. Let's have you stand up and see how the knee is. What do you think? How about squatting? What does that look like for your knee? Or you don't dare?
It clicks when you walk.
It might be his ankle.
Filming around the room.
That's the ankle, right?
I don't know who to look at.
I can't. What did? Yeah, I thought it was the ankle. Also.
Yeah.
It's that. He's the bionic man.
Only if it was true. Maybe it would actually be better if it was hot and stuff.
So you're limping on it, it appears like.
That's painful there.
Where is it?
For some reason that's stopped.
That's the opposite side.
Well, yeah.
Yeah, that's not
Was
injured
this
side,
on the
is it?
right
I
side
know it
before?
was. This is all right.
Okay, I'm like thinking, maybe I did the treatment all on the wrong side. What the fuck is the matter with me?
All the time.
I know, and the nurses go, it happens in the hospital all the time, that's why we mark it. Ignore the left one, I'm sorry, I can't be responsible for the left. I mean, it's a different story. I mean, no, I'm just curious about the right, really, at this point.
Yeah, it's gone back to being weak again.
Oh.
Yeah.
Hold on, okay. It's gone back to being weak, you're saying, right?
Can you squat on?
Okay. Wrap your fingers around my neck
No, John, no.
and just go down. Keep going down. Let your head go. Keep going down. Go any further with the knee. Don't stick your butt out. Bring your butt. Okay. Bring your butt towards your heels. Yeah. You're squatting with me. I'm holding you. Yes. Yeah. How's the knee?
It's all right. Yeah, it's not.
Sorry.
Usually I would feel like it's going to snap. I feel
I'm gonna. Okay. And you don't. Okay. I'm gonna bring you up. And what do you think? Because if you're squatting for the knee, there's a difference between squatting for strength and squatting for movement. If you're squatting for movement, you've just got, because of course his ankles, he's not a squatter. It's pretty obvious. You should be thankful you don't live in India. But, so you have to hold, you hold something and you squat, but you're doing it for the movement of the knee, you're not doing it for the strength. So, that's different. So you said still weak, right?
Yeah.
Okay. When you're walking, it's weak.
Yeah.
Okay.
It's always a bit.
I'm walking with you. Go. Still weak? Why don't you come? I'll walk backwards, you walk forwards. Okay, because I can't walk through the table. How's now?
It's better. A little bit better, probably like 30% better.
Okay, fine. Okay, let's turn around. Okay. Walk. What do you think now?
30%.
Okay, fabulous. Lie down for a second. Let's see if I have press decks, then we'll release you because you have to be here for a while, and if not, with needles.
But I mean, realistically, you wouldn't expect it to kind of, would it be pain-free after one, or would you?
I expect anything I can. I mean, who knows? I told you, I do the best I can. I'll keep them in as long as I feel it's doing something good. So these are basically, you've seen press decks? Mm-hmm. You know, they're just like thumbtacks, except they're sterile. So the idea behind the spleen 10, and you know, I'm basically doing a facelift. I'm doing a facelift for the quads. Okay. Trying to get it angled it slightly that way. That's all. So hold on, I'll put some extra tape on so it doesn't fall. It's always a bit of a drag.
Oh, right, okay.
Someone can find the opening to the tape, especially if they have nails.
I'll write a minute, thanks.
And you have another tape, you don't need it.
No?
But it may have the same problem. You did! Ah! You can take a shower with these, you can do whatever you want. If water gets in and starts itching and you don't, or soap and it starts itching and you don't like it, just rip it off.
So would you get him to palpate with these as well, or just leave them?
You can tap on them, or yeah, he can press on them. Yeah, absolutely. Yeah, I mean, of course you guys are familiar with it because you probably, if you do ear things, it's the same stuff. Yeah. Now, you can get the sarin ones that have much better tape and they're very gentle press deck. I actually use the sarin one, the PNX things. I actually use them on joy points. Yeah, people can walk in. Not in the summer without but if they have socks on, yeah. With a PNX, I have a few patients that don't mind these. Like that. If you have a little bit of padding, it's okay. So let's have you walk again and see what you think.
Green ones or the red ones under?
You know, it's like I never know what size is what, so whatever I happen to have, I'll put in there, because I do. What do you think? Well, you're not limping as much. It appears, I don't know. Anything to do with clicking, I tell them don't ask me about it, because, no, I know it disturbs people, but I don't know how to address it. So as far as I'm concerned, I shut my ears. Yeah. No, because people say, this is, and I'll say, there's no pain, but it's still clicking. It's like, well, I don't know what to tell you. What do you think?
Yeah, it's about 40-50% better.
All right. All right. Thank you.
Thank you very much.
So keep them on for 3 days. Right stem 27. Nothing? Yes?
That seems fine.
Seems fine, okay. Adrenal. Doesn't feel to me like anything. And this is actually even softer. How about red 9?
No. Seems sort of fine.
Yeah, cool, that's fine. By the way, I won't say slow pulse. But interestingly enough, okay, take the pulse. I think it may be more interesting than the abdomen. You can take on this side. Anything? A little bit tight here, right? Compare. Oh, you have an interesting rib too.
Ah.
Who was the person with one rib this way, one rib this way? No, he is, it was you.
And a lady yesterday.
Lady yesterday, wasn't it?
Lady.
Yeah.
There was someone this weekend
Yeah.
with one rib this way, one rib this way. It wasn't him. Was she your patient?
No.
No, I think it
I was
was.
just going to ask if you had
Sarah,
it.
wasn't
Yeah.
it?
Oh, okay. This is an autonomic nervous system pulse.
Okay.
It's wiry, thin at the top, right? I can't guarantee your side would be like that. When you press it in, it doesn't disappear, but it definitely changes. It becomes more. It becomes bigger and more aggressive. The wiriness didn't exactly disappear, but it. Do you feel that? Because I don't want to like bullshit you, and I want to make sure that that it makes sense to you.
Yeah.
And 17. Okay. So I don't know what your story is, and if there's what's your blood pressure?
I haven't checked for a
Oh,
long
by the way, we
time.
didn't do under third toe for her, which we should have.
Yeah, I haven't checked for a long time. but
What was it when you last time?
I have
you
no
checked?
idea, to be honest, but I don't
Okay,
think there's
then
anything
forget-
abnormal.
Okay, fine. I'm just always asking if I find. 1, 2, 3.
3 is tender.
3. 1, 2, 3.
Fine on that side.
Fine. Okay. Back. 1, 2, 3.
Yeah, all
This
mainly 2 and 3 as you go down as well as. Yeah,
Okay. 3.
definitely
and
3.
1, 2, 3.
Better on that side, 3 a little
Okay.
bit.
Therefore, should be okay. Compare this one and this one.
But they both were okay actually. to be honest.
How about here? Don't worry about okay. Just worry about if they're the same. Okay.
This one feels puffier.
Yeah. Okay. Compare. Yeah, different.
Yes.
Very. I mean, you can see in my hand, I'm picking up more. I can't. This is like nothing comes with me, and this one it drags over it. Okay. I'm gonna guess that it's a fatty liver.
Oh yeah, that actually is kind
Okay. That's
Oh,
tender.
shit.
Oh, sorry. Anything here?
of, that's okay.
No? Yes? No? Okay, but this is tender.
Yeah.
Okay.
Like, not a lot of any of this was tender.
Yeah, I know. I was okay. Sorry about that, just for a second. Okay. How is...
Oh, that feels more like the stomach now.
Okay, yeah. Fatty, yeah. I think
Steal my
fatty
socks.
liver. Somehow I think fatty liver. Okay. So if people want to... Oh, wait a second. And when I do this... Sorry, but I'm... This one. How is this now? Number 3.
I think 3 was still lower.
Lower? Here. 1,
Yeah.
2, 3, and I'll give you 4.
Yeah, 3 was still a bit painful. Maybe I'd say 20, 30% better.
Okay. But the main one was 3 and 4.
Again, maybe 30,
Okay.
60% better.
Can you press liver 1?
Just the ovary.
We'll start with that.
The pain goes a bit, but it still feels like full and uncomfortable.
Try a different one.
He's got hairs there.
That's the description of the liver 1. 3 hairs above the hair or something. How's now?
Less pain. Yeah, less pain.
Okay.
But it still feels like something's wrong there. I don't know.
Okay, something. Okay. I'll take care of it. Why don't you go ahead and
I did have
palpate so he can give you feedback.
C3 manipulated.
You've had C3 manipulated?
On Friday.
Okay. All right. Do you work at a chiropractor's office or something?
No, but I would study with an osteopath.
Oh, okay. Whoever wants to get a chance to. Yeah.
I have a right knee injury at the moment.
Oh. Okay. And are you having this interesting cutie thing?
It's to spread my
everywhere? Or
toes.
another one?
Yeah.
So Lawrence, that I
Sure.
use
Yes, once I
personally.
did it,
You won't see Kiiko doing it. Well, with adrenal, it's always the lower kidney first, then you add kidney 27. There's no question about that. You don't start with kidney 27. I generally start lower, move upper, and I take out from upper to lower. Kiiko, one of her Voxa girls said to me, "That's not true, I don't see her do that." You know, and I said, yeah, because what she says, she comes into rooms, take it all out, so the Moxa person is taking the needles out. I said, just don't take them out and see what happens. She said, you're right. She'll do it from top to bottom. So, it's one of my quirks. I was originally, when I was taught needling in school, I was taught from yang to yin, and the same way take out, from top to bottom. That was what I was taught. So it's not, but I somehow picked up this other thing, and it's not necessarily important, but you know, just in case you're interested. But some the combinations in like the kidney lower first, only kidney 27 only after. Let's have you stand up and see how the back will feel in regular, not lying down, and then we'll continue.
Feel a bit funny.
Here, immune style. Okay, so because we haven't done, we should have done. What did we do immune point tomorrow?
No.
Okay, because we should. It's part of the autoimmune protocol. Okay, so and how's the neck?
It's stiff.
But not painful. Okay, let's have you face down. Just know that you're talking towards the floor, which means that I will hear you less. So you have to speak up a teeny bit. Yeah, sure. Thank you. Now, one of the things that you will see on people, sorry, is the horse scalping. So a lot of people with autoimmune disorders will have gumminess on UB27. You don't like.
No.
But she doesn't have as big, like some people it's like this size, you know, like 1 pound size or 2 pound size. And it's like, you can really feel it. So on her, I can't say. So, but this is not comfortable, right?
Not at all.
Not at all, okay, fine. How about, you said sacrum, right? How's that now?
It's still quite tender.
Quite tender. Okay, fine. Yeah, it's full. It's not super rough. Okay. Any pain here? Or here?
A little bit tender, but not really a lot.
A little bit tender. Okay. So in other words, I found I was going to go for a different combination called Ihikon, UB60, 58, 40. Because sometimes we add that for autoimmune with also things that started with fever or head injury. That's the combination that we use. Okay, you said here, right? Okay. When I press on the toes, how's now?
It's probably 50% better.
50, well, thankfully we have another side. So 50 plus 50 is usually 100.
Usually.
Sometimes it's 50 plus 30, but I'm hoping that it's 50 plus 50. Sorry, are you okay? Gentler needles.
So you're doing
66 and 67 metal water. Because she had something on 60. I was thinking, gee, can I add Econ? But instead I'm ending up with, sorry, no more tricks like that. Hi,
Still a little bit there, but
how much is, so 50 plus 50 is not 100, but how much is it?
about 95.
Hmm?
About 95.
95, okay. 5% is not the end of the world. Figure it out. Okay, so remember, blood pressure, I want to go for small intestine like that. I mean, I could, even though she's rapid pulse, I could now do UB42, UB52, blah, 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 blah. I could go for that. But let me try, by the way, in the neck. Anything left?
Not really.
The reason I would have preferred econ is because she had a head injury to begin with. Okay, but you know, since 60 was painful, I was like, let's try 60, 67. But in the future, maybe you may find that UB60 upwards, UB58, and this UB40, well, no, we're jumping up and down for the rugby people. UB40 is more side, you can say call 39, but do you see how there's a triangle here? I take on the side of the I needle it into the triangle this way, superficially. Kiiko needles here and upwards, but we used to do it this way. So some places I just, you know, this is how I learned originally, so that's what I keep doing. Okay, so, I can't remember what oh, by the way, you had here, right? Still, right?
Small bit.
Small bit, okay. And 5%, and how about anything?
Not really.
Not really, okay. So this one and this one, yeah?
You're doing 4 chords.
Yeah, I'm going to do 2 in all likelihood, because the number 3s and 4 is, or 2 and 4, depending how you count it, is busy with, it's too close to the page, and she, so. How's now? The shoulder and hip off?
Shoulder's okay.
Okay, and how's 5%?
That's mostly gone.
Mostly gone.
Sorry, that was the
Small intestine 19. By the way, also for autoimmune, I have a few. I cannot touch 216, because that's one of her complaints, but I can touch small intestine 11. So I'll show you. This is okay now?
Yeah.
Okay. But this here, tell me when.
There.
Boom.
Better.
How much?
90.
Hmm?
Don't mind.
90%.
No, okay, thank you.
Oh.
So did you say 11, then a 9, 10?
No. I want to do 11. Okay, this is 19.
260.
Right. Going outwards. What we can do is either hairpins. Oh, wait a second. Could you lift your belly for a second, Morris? Thank you. Well, it's not okay. It's not important. It's okay. It's okay. Okay. Now, how is this guy here now? Before you didn't like it. How is now?
Much better.
Much better. Okay. Still something?
Yeah.
Okay. So something. So I'm looking for. Sorry. Oh, yeah. How's now? No, not rhomboid. No, nothing to do with the rhomboid is here.
Yeah, inside.
And I am now on this edge of the sacrum. I'm pretty far from the edge of the sacrum, but it's still, yeah. Okay, here, right?
Yeah.
Okay, when I press up here, how is
That might be better.
much better? Okay.
This was the dotted line down bit.
Hmm?
This was the dotted line down.
No.
that's 11,
This is
it?
small intestine. The rhomboid is here.
Yeah.
This is on the scapula. This is small intestine 11. This is her scapula.
Okay, fine.
So I'm going to surround small intestine 11 because it's puffy. Thank you. So you can see how autoimmune and small intestine are related, right? Small intestine 11, rent 4. It's all small intestine shoe. I'm in this case using as a prognosis. The gummier it is, the worse the disease. Okay? The more easily I can change that gummy on the sacroiliac, on UB 27, the more easier the condition is going to respond to acupuncture. Now, so this one is okay now? Much better, okay. How about this one? Still there, right? Okay. here. How's now?
Call it the 85.
85, hold on. Unlike the Japanese, I don't do it with one hand.
So surrounding it because it's puffy.
Yeah, small intestine 11, we do it, we surround. Hi.
90.
Okay, 90 is okay. Anything above 80 is acceptable. You don't have to be a perfectionist. Do you like breads, carbs, sugar? Can be other.
Yeah, I suppose it is.
Hmm?
Yeah.
Okay. No, because if she has any inflammatory condition, no, listen, some people get big nut with carbs. You know, that doesn't have to be, of course, because they're bigger, they must eat lots of carbs. Some people, first of all, some people have metabolic disorders, other people eat lots of meat or, something else. But because sugar is going to affect inflammation, okay, so that's why I want to reduce. Whenever you have a patient who comes from musculoskeletal disorder, tell them to stay off sugar for at least a few days. All carbs, all sugar, okay, for a few days, because otherwise they're feeding the inflammation.
Then what's afterwards? What's afterwards if the pain's not subsiding?
Well, just eat broccoli forever. No,
Yeah.
eat kale. Kale is very anti-inflammatory. No, but it's like, you're trying, but
Yeah.
you're eliminating one of the causative factors. Don't feed the inflammation by having sugar. How are you doing? All right, thank you. Be back. All right, shall we?
Touch, but it's not actually been impacted on anything.
And where is your pain without touching?
It's around the medial crescent and below, but just quite general actually.
1, 2, 3, 4, 5, and 6. You say pain.
They're all fine.
They're all fine, even though this is where you palpate.
It's like on the patella corner. It's a very weird sort of specific.
Well, you have a very mushy patella.
Mushy.
Touch. Touch this.
Do you want to compare?
Oh yeah. It's not.
This is a little
It's
also.
very mushy.
Don't you think? Both of them. It's really interesting. Look how puffy it is here. Instead of an inner knee eye, he has like a boxer, puffy eye, boxer inner knee eye. Okay. So can you show me where this one will be?
It's like right on the corner.
And it has to be pressed up. Okay.
Yeah.
Yeah, I got it.
Yeah.
Okay. So, relax, okay. Patella's usually stomach chi, but let's just see if this does it.
Tender on the foot.
Okay, forget the foot. How's the knee?
The knee still feels a bit tender.
Is it any better or not?
Maybe 20%.
20%. Then it's not much, not worth dealing with. Now?
It's difficult because it's just a very specific point on the knee, and it's easy.
But I haven't used my.
Hasn't moved.
Okay, hold on. No.
Yeah, just,
Hi.
yeah, that's it.
I have
that's
it. Okay.
Again, maybe 20%.
20. Okay, so that's not the solution. Excuse me. He has very high hip bones. They're going almost above his navel. So his gallbladder 26 ends up on the bone. So, so, okay. Am I getting it?
Yes.
His patella is moving and it's unstable. Hi, how about now?
That feels better, I think.
How much?
say about 80% better, but I just, there's still another angle. I just want to make that.
Okay, hold on.
Because it's when you press on it, the patella moves, so it's very easy to sort of move.
Okay, hold on, you hold. It's okay, no, you go ahead and hold. No, you hold. You hold. Okay, now how is it?
Yeah, maybe 50% better, but it's still there.
Okay, hey, 50, it's gotta start somewhere. Gee. Plus, you were not in the best position for gallbladder 26, so, you okay?
The journey of 1,000 miles begins with one step.
With one gallbladder 26. Begins with 26 gallbladders. That's a non-vegetarian comment, okay. Actually,
There's improvement.
There's improvement. Okay, next. So the thing you saw me doing on Ali, I'm basically doing a facelift for the quad. And that will stay, hoping that they will stabilize the patella, because then the quad can hold better. Hi.
Can you just press the knee one more time, sorry?
With this?
No, the patella.
Without anything. Baseline.
Yes.
Boom.
Yeah, almost gone.
Almost gone. So this is, Hawaii like these a lot. And I needle upwards, regardless of which meridian, the direction of the meridian, because what I'm doing here is like, I'm lifting the quad. And I tend to add to it something like stomach 31. Don't know if it's exactly stomach 31, but unfortunately we can't see. But we can't do that.
So pull my trapeze now.
It's gonna all crumple exactly where I want it to. Okay. So how much is left?
But there's still some, maybe 20% left.
Okay. Hi, how much is left?
Maybe 10.
No. Actually, I think it's supposed to be stomach 32. 31 is higher.
Yes, it does feel less.
How much
I
less?
can't say exactly, but it's... yeah, I can't sort of say exactly.
I'm going to send you to Alec. Okay, so decide when you can tell the difference between this one and this one. Sorry.
Yes, that's almost gone.
Okay, good enough. Now, what's the purpose of doing this? Besides the fact we didn't find a lot on the abdomen and stuff. But I want to show you there's other ways you can apply this. Okay, so yes, what I'm telling you is treat the constitution, absolutely. But when you go back to your clinic, some of the easiest things will be take this trick, take this, and see what comes out of it, and then it will encourage you. Like, oh wow, this works. Yeah, cool. So that's why gallbladder 26 for any sort of musculoskeletal worth trying. And then you're starting to get your hands moving on people's bodies, which if you're TCM oriented, you don't do. Okay, so just starting in any way you can to just start touching and doing things with people. That's the point here. Okay, you can't have the whole system down. But you need to start somewhere, and the thing is, you can't wait until you can't wait forever. Now, by the way, you said almost gone. See, I can't help myself. Almost gone?
Sorry, that's just hurting those needles in the leg.
Oh, I'm sorry. Almost gone? Some left?
Yeah, possibly if you just press a different angle. there lower, so yeah,
Okay.
that's still painful.
By the way, I hate to tell you, this is not the upper edge of the patella, this is the lower edge of the
Oh,
patella. You
sorry.
have so much puffiness below. We think this is the patella. This is water. This is not the patella. The patella, he's on the lower border, okay. Because of the pulse, under third toe. High.
Maybe 50% better.
Okay, hold on. Here. Wait, we have to get this over, so. Okay. All right.
How many acupuncturists did it take
To take a suck. Many. Would you press under the third toe?
Brilliant.
With your nail. Yeah. Okay. How are we doing now?
Yes, probably about 80% better.
Okay, so I still, you can see that you can do all the tricks in the world, and yet you can still get extra by treating whatever you think is the constitution. So it's always interesting that it's still going to come in. So yes, you can treat just by tricks, but I'm always proven time and time again that no matter how many tricks you do, and they can appear great, now they will last longer if you add the constitution. Okay? No patient likes it when everything is better on the table and the next day they get the pain back. Because it makes them feel like you cheated them. You made them pay money, made them look like it was good, but then we really didn't do the right thing. So they don't like that. So, it's better to treat, even though it doesn't appear to be related, like, okay, yes, it's a patella injury, it's not the blah, blah, blah. Why am I treating your gallbladder? Why am I treating your liver? Why am I treating your digestion or whatever? Because if you don't, the knee will grab. Make sense?
Mm-hmm.
Why do you think there is accumulation of fluid on both knees?
I think it has to something to do with the way he's carrying his pelvis.
Yeah, my pelvis is, I've got problems with that line. Sorry.
It's right. No, it's okay. He tends to, it's like he's spilling his pelvis that way, so the way the weight goes onto his, he's doing the opposite of what you're saying. The younger people say, don't do this with the hips. His hips aren't gathered, kind of thing. They like to splay. Therefore, the way, if you do this, you don't have to do, I'm just trying to show you. So if you're doing this, you're splaying this out. The way the weight falls is going to be into the inner side of the knee, and it's going to be like straight down. It's going to, remember like with the palpation, the vector, how you controlling, there's no control for the vector, it just, so everything just falls and the patella gets weak, okay? If he can figure out a way to widen the sacrum, not the butt, okay, which is very weird, okay? It's because you don't want to tighten, you don't want to like take this away by tightening the butt and just like being, holding like this. But, so if he can find a way to let this drop, so now the weight is dropping through the outside of my feet directly into my heel, and there's a lift in the upper, in the quad. He can't do it when he's like this. When he's splaying these bones, when he's taking the ischium or when he's doing this, he can't feel his inner legs.
So that's exactly right. That's exactly right.
Yeah. So so all the weight just falls there, and then over time, granted you're young, it's only over 60 years, so wait, it's like, do you need to wait until he's 70 to see what the result will be? It's like, but so I think it's like that, something is not willing to let go in the tailbone and allowing the sacrum to just drop and widen without, he's trying to hold himself up a lot.
Yeah, and that feels like exhausting.
What was that needle? Sorry, was that above trochanter?
This, no, the trochanter will be here. The stomach 31, 32 area. Okay. It's a support for these two to activate the quad.
It's a weird thing. It feels, for me to hold the correct posture, it feels exhausting. feels like it's genuinely like sort of very tired.
I'm going to suggest that therefore it's not the correct posture. If it's that exhausting, it can't be correct. So no, so maybe there's a different way to look at it. You know, let's take her out and we can talk more about it. Take your time. How many hours is it going to lie down there? I have no idea. Better have a reason to have them upright. Okay, but also, and then when they go out, they feel like easier. So what I'm doing here. Anybody have a thing just so we can see better? No, nobody has it. Okay. Oh, you do. And I can do it with it, right? It's just that you'll see better. You sit up. Thank you. Now, if it hurts, which it will, but you're controlling it, what you do is you send your sit bones down into the table like hell. Okay? So you're basically pushing down like hell. I'm grabbing the trapezius from in front of gallbladder 21 down and towards the other side. And I'm just using my weight. Look to the right, to the windows. Okay. Keep your eyes at the same level. Don't look up or down. And take your head, the nose, and start looking towards the door. So once you pass the midline, keep going. That's when it's going to hurt.
It hasn't got to the midline.
Okay, so keep going a little bit. Breathe. Keep going. Keep going. Breathe. Release the left shoulder. Yes. See, it went more. Now, I know it burns into the ear and the eye. Yeah? Yes. Sorry? Okay. It just hurts. Okay. Keep your head to the left. Go towards the window and don't look down. Send it to look down. Don't look up or don't look down. Keep going. Go, 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 go. You've got time before it hurts. Okay. This opens up the scales. Hold on. I'll do it on some of you.
Got you.
Yeah, but your angle is bad, so you can't feel pretty good. How's that? Release the right shoulder. No, don't release the head. Right shoulder. Now what about that is? Okay. Now that it's done, how does it feel though?
Much better.
And your head feels lighter, right? It feels like, this is cool, I've had a cup of coffee. All right, thank you.
Cheers.
Thank you.
I do this on almost everyone. It's a
Whatever
really
they come
nice, whatever they came for, because you can't go wrong releasing the neck.
Space and life.
Hmm?
I was just trying to deliver the post.
And then we